Yes, the human microbiome is the total repertoire of all the genetic information and the function of that genetic information expressed by all the microorganisms living in or on the human body. The human microbiome has become a commonplace word in our vernacular now, as we hear about it being associated with conditions like metabolic conditions like diabetes or obesity, allergic conditions, even there's a brain-gut axis. All these things we hear about every day, but a lot of us don't realize that the microbiome is even more associated and even greater evidence and greater strength of association with infectious diseases such as Clostridium difficile infection and antimicrobial resistance. Yeah, well, first of all, I'll just say that antibiotic disruption or dysbiosis of the microbiome is very, very common, especially in healthcare settings where patients are often receiving antibiotics, sometimes for extended periods of time. In the larger scheme of things, antibiotic-associated dysbiosis has been, again, associated with chronic conditions. We've known for a long time, for example, that antibiotics fed to animals promotes their growth, and they're commonly used as growth promoters. And even in animal models of human disease, early antibiotic exposures seem to be associated with weight gain later in the animal's life. And of course, we've seen these associations on a population scale with antibiotic dysbiosis and weight gain in humans, but other conditions too, like eczema, asthma, allergies, even cancer, especially colon cancer, unfortunately, associated with antibiotic exposures early in life. As important as those things are, it's the infectious diseases that people aren't always thinking about, but actually have not only a stronger dose response effect from antibiotics and development of these infections, but also there's a shorter time scale. So we commonly see people get even just a week of antibiotics, and then they'll be at increased risk for Clostridium difficile infection over the next 2 to 3 months. So it has real impacts there. It's also associated with a cycle or a cascade of events that's happening all the time in healthcare settings around the world, and that has to do with antimicrobial resistance, where antibiotic-mediated dysbiosis of the microbiome is predisposing people to become colonized with antimicrobial resistant pathogens. Further antibiotic-mediated dysbiosis leads to the overgrowth of those pathogens, and then that promotes the development of infections and transmission. That transmission then results in another cascade starting all over another patient. This cascade is happening all the time, over and over and over in healthcare settings around the world, and is actually leading to far more deaths than we even realize, just below the waterline of what we really recognize.